right. Okay, so thank you all for coming today. I am really excited that you are here to join us. This is the last of a three-part webinar series provided by the Kansas Stepping Up Technical Assistance Center. But no fear, I have many other webinars and learning opportunities up and coming in the future. So we hope that the conversation today will leave you having a better understanding of a Stepping Up framework, as well as some tools provided by the Justice Center to best assist you as your county leadership moves along and does this work. Next slide, please, Risa. Thanks. All right, so joining us today is Mike Brower, who is the Criminal Justice Coordinator now that we have decided the fifth Criminal Justice Coordinator at Johnson County. Katie Haber, who is our Program Director with the Council of State Governments Justice Center. Risa Hanneberg, who is a Deputy Division Director with the Council of State Governments Justice Center, and myself, Audra Goldsmith, a Senior Policy Analyst with the Council of State Governments Justice Center, working specifically right now on the Kansas Technical Assistance Center. Next slide, please. All right, so just a quick reminder, I know that we do have a couple of new folks on the call today. Stepping Up is a national initiative to reduce the number of people with mental health and co-occurring substance use disorders in local jails. The CSG Justice Center partnered with NACO, which is the National Association of Counties, as well as the American Psychiatric Association Foundation to launch Stepping Up in 2015. And due to this broadly supported issue of high populations of those living with behavioral health and co-occurring disorders in county jails, and a behavioral health system really feeling like a resolution, to this problem is really impossible, this Stepping Up initiative was formed. It focuses on data-driven cross-systems processes that are really designed to meet counties where they are and provide critical support for achieving results. It helps counties to identify a target population, select strategies that work, and support scaling those up, and also gauge progress towards common system goals as they move through the processes. Kansas and the TA Center became connected as part of the KDADS Justice and Mental Health Plan. So across Kansas, local communities recognize the growing need to find better solutions for linking people with mental illness and co-occurring substance use disorders who are in the justice system to treatment and services, while also providing public safety. And KDADS, the Kansas Department of Aging and Disability Services, is working with local behavioral health and law enforcement leaders to address this need. And so thus blossomed the Kansas Stepping Up Technical Assistance Center as a result of local leader recommendations. Next slide, please. Perfect. All right. So Stepping Up has been around for 6 years and counting, and we have now over 540 plus counties across the nation that have signed a Stepping Up resolution. And there are 5 states who have launched statewide Stepping Up initiative, and that is Pennsylvania, Kansas, Ohio, Alabama, and California. And Kansas joins Pennsylvania in being only the 2nd state to have its very own personal technical assistance center. So next slide, please, Risa. Thank you. All right, so how does Stepping Up support counties where they're at? Through providing resources. That includes some do-it-yourself tools and research analysis, one-on-one trainings that can be phone calls or virtual site visits. We also provide group trainings, connections to national experts, connections to data experts, and connections to colleagues through different county examples. Next slide, please. So we work to assist counties in finding sustainable, realistic, impactful services that will help reduce the cycling of justice-involved individuals living with mental illness. And Stepping Up has a really strong focus on that data-driven approach to help guide those assessments and implementation, and also looking at the longevity of these high impact strategies. Next slide, please. So far in Kansas, we have 11 Stepping Up counties, and we have 3 innovator counties, and that is Reno, Douglas, and Johnson County. And we have 2 counties that have participated in the Set, Measure, Achieve project that is going on right now within Stepping Up. I do want to note quickly that I was doing a little bit of research the other day, and Iowa actually has us just blown out of the water. They have 60 plus Stepping Up counties across their state. So that's kind of a goal with the Kansas TA Center, is to really continue moving this initiative across Kansas and getting more counties to make the commitment on reducing their mental illness within their county jails. So next slide, please. And here are just a few resources, and we're going to take some time to go through each of these tools today. The Coordinator Handbook, which is a step-by-step facilitation guide for your project coordinators in your county, a document on reducing the number of people with mental illness in jails, the 6 questions county leaders need to ask, which is a really nice blueprint for counties to assess their existing efforts, and then Stepping Up, a self-assessment tool. And this is a resource designed to evaluate the status of counties' current efforts, and it serves as a guide to counties when determining their implementation progress according to the framework that is discussed in that 6-question county leaders need to ask document. And then lastly, we're going to also touch a little bit on the Stepping Up strategy lab, and it's a really cool interactive library featuring hundreds of examples from across the country on how counties implement programs, policies, and practices in their own sites. Next slide, please. All right, so first I would like to discuss question 4. So have you conducted a comprehensive process analysis and service inventory? So your Stepping Up committee can complete a process flow analysis that really charts how a person moves through the system from that first time of contact with law enforcement until that final case disposition. And then it will use data to illustrate current capacity as compared to need. So if your planning team has completed a sequential intercept map or a SIM workshop, this is a really good place to start. In fact, some counties work on revamping their Stepping Up committees, pulling out that previous SEMS report and readdressing and adjusting your strategies and objectives outlined in that report could be a really good starting point as you are trying to get your feet kind of back running with the Stepping Up initiative in your county. If you're a small or rural jurisdiction, seeking out other rural sites or reaching out to your TA center to learn how they have addressed specific challenges could be really beneficial. The gaps you might identify could include that lack of behavioral health resources and few, if any, of those non-judicial system alternatives for law enforcement, especially when they have had contacts with individuals during that non-traditional working hours. So that could be co-responders, now being called community responder programs. It could be diversion drop-off centers like CSUs, or different things like that. So learning how other rural sites have addressed these challenges and consider connecting with nearby jurisdictions and discussing on creating shared or even regionalized services could be really beneficial. So lastly, in this step, we also want to use timelines to help establish goals and expectations for subcommittee work within your Stepping Up Council. So next slide, please. All right, so really I wanted to use this slide as an example. This is a systems analysis from Athens, Clarke County, Georgia. And I think it just really nicely illustrates the complex and fragmented systems that a lot of states and counties attempt to navigate through. And I think it illustrates just how easy gaps can be made and how barriers can really inhibit the process of someone moving along that system without collaborative work being done by all stakeholders in your community. So next slide, please. Okay, so Mike Brower is here today with us from Johnson County, here to discuss his depth of experience in working with process analysis and service inventories in Kansas. So Mike, I will turn it over to you.
Thanks, Audra. And so as many of you know, I've been in Johnson County a whole 2 days, although I worked here previously a decade ago. And so I'm going to kind of share with you some examples for both Douglas and Johnson County as to you know, how this work can be done. And so there's a few ways to do some of this process analysis. And incidentally, both Johnson and Douglas County used a deep data dive with the CSG Justice Center, which was really an intensive project. But really in both counties helped us to get our data organized and into a pattern where we could do a good job of analysis. So in Johnson County, interestingly enough, CSG and our data dive helped us conduct a sequential intercept mapping back in 2011. And that was actually, at that time, Risa Hanneberg worked for Johnson County and was part of that steering team, led that project. But we collaborated with CSG to complete that. That led to applying for a Justice Mental Health Collaboration Program grant. I'm sure that you've heard CSG talk about those, as they're the national technical advisor for those grants. We utilize that here in Johnson County to get the co-responder program started. So currently, Johnson County is in the process of working on data dashboards to launch this data, to continue to put out this data in a usable form and providing analysis. In Douglas County, took a little bit opposite approach. And they applied for a Justice Mental Health Collaboration Grant, which the technical support came from CSG, and working on that. I'll talk a little bit about how they targeted that grant to improve their system, but that then led to completing a sequential intercept mapping with PRA through a SAMHSA grant. And I'll show a picture in a little bit of the data dashboards that Dr. Matt Cravens from Douglas County, who's joining us today, has created. And so that work has led to a little bit into question 5. We're going to talk about how we use that data to identify services and opportunities moving forward. And so they are piloting launching a mobile access team to provide services on the weekends in person to where people are at in the community, and then also a collaboration between 911 and 988 for the emergency system there. So next slide, please. So this is an example of the sequential intercept mapping, which both Audra and I referred to. This is the map completed by Johnson County and updated, I believe, in 2015 with the help of SAMHSA. Keep an eye out for those SAMHSA grants. They will, if you apply for a grant and receive it, they'll come work through this process with a little pre-work, 2 days on site, and then some follow-up meetings to complete a map and recommendations for you. Reno County has used that, as well as Johnson and Douglas. And you can flip to the next slide there, Risa. I know that Shawnee has talked about doing this as well. So here's the example of the Douglas County map, which was completed a year ago. And interestingly enough, when we did the work with Douglas County early on, we really felt like we had devoted a lot of services and resources to intercepts 4 and 5. But we're not putting a lot of resources in intercepts 0 and 1. And so a lot of the recent work in Douglas County has been to create balance within their map for the services that they provide. Next slide. And so this is an example of how, part of set, measure, achieve. One of the goals, not just setting goals in the 4 key measures, but also was to begin to be able to display this data publicly so that stakeholders, policymakers, and then citizens in the community are able to see our data and where we're at as well. So this was launched in Douglas County in, I'm trying to think, I believe we launched it in June of this last summer. And missing one of the key measures, which is connection to care. And I want to point that out to say that you don't have to have data on all 4 key measures before you launch your dashboard. I was speaking with one of the programmers from Johnson County today, and you simply could do this by putting your data on a spreadsheet, creating a graph, and posting that graph to a website. So lots of ways to make this happen. And I'm looking forward to seeing the work of the other counties in Kansas as we begin to work on that. So next slide is on to Audra.
Yes, thank you so much, Mike. I wanted to just give everybody a little bit of a glimpse. This is actually a snapshot from the coordinator handbook. And for folks whose counties haven't completed a SIMS workshop, the coordinator handbook can be a really great tool to use. And they really help provide a framework for counties to use when you're kind of conducting your own process analysis, maybe on just a little bit of a smaller scale. And it really shows you how each service or each program or each policy you have can line up with those 4 key measures of stepping up. And it includes some really good questions to kind of ask your committee and ask your county leaders as you work through that process analysis. So I will later in the webinar, I'm going to post the link for the handbook so people can have easy access to that if you would like. Next slide, please, Risa. Thank you. All right, so question 5 is really kind of diving into how to prioritize your policies, practices, and also funding for the improvements that you want to do in your county. So upon gathering all of the data and completing that process analysis, it really helps your planning team to prioritize those next steps. And your project coordinator or leaders within your Stepping Up Council really play a key role in shepherding that planning team as they develop those policy recommendations and budget requests that are practical, concrete, and really align with the fiscal realities of your county. So you can develop a list to help prioritize what strategies are most important and would be most meaningful at that time in your county, and then kind of walk through completing a detailed description of those needs so that you can start developing a proposal for your ideas and what services or policies you're wanting to get implemented in your county. It helps to really provide you good estimates and projections of those new strategies on how they're going to be, how they're going to impact your county. And then it really gives you some good questions to ask and good guidelines when you're talking about funding streams, whether those are external funding streams like Medicaid or housing assistance, state funding, including some grants for mental health or substance use treatment services, as well as federal and state grants that might be available, and any local resources such as hospitals or things like United Way that might be able to provide some funding resources. And then it really helps to kind of identify some of those gaps in funding that might be where some of your county or your city officials need to have some skin in the game and be able to maybe support some of the services that you're looking at doing in your county. So next slide, please. All right, and let's see, Mike, did you have any additional on prioritizing your policies you wanted to add? I think I have
Yeah,
one more slide and then I'll kick it to you.
yeah,
Sorry.
I have I added a slide the last second
You
on
did.
Audra.
That's
So
all right. All right. Okay. So in this one, it's just really looking at the 4 key measures and maybe some potential system improvements. So as you keep that planning team focused on the 4 key measures, it'll help ensure that you're prioritizing those action steps that are intended to impact 1 or 4 of these 4 key measures. And these are just some examples of strategy priorities under each of those 4 key measures that also line up with those intercepts that you'll become familiar with as you potentially work through a sequential intercept mapping. So Stepping Up really tries to provide county with guidelines on planning the process via those kind of 6 foundational questions, as well as baseline data and progress through these 4 key measures to help really identify these high impact strategies to implement or help scale them up. So next slide, please. There we go, Mike.
thanks, Audra. So this is an example. This is from our deep data dive with CSG, and you can see how they went through each of the key measures. And I do apologize that the writing here is a little small, but I will post links so you can download these documents if you want to look at those, both from Johnson and Douglas County. But we go into each key measure and list recommendations that were developed from our key data drive or from our deep data drive. And you see some of the examples there of expanding mobile crisis response, which is one thing that we are working on right now, is actually hiring staff for what we will call our mobile access team. We also incidentally used that same method of data collection to identify we knew we couldn't afford to pay for staff to be providing that service 24/7. So we said if we could hire staff for 40 hours a week, when are they most needed in the community? And so working with our partners and collecting data, it actually showed that Friday night, Saturday night were the most important. And believe it or not, late Sunday night was actually another high priority time. And so I think it's only when the Chiefs lose that, no, that's a joke. But because we've lost the last couple of Sundays, but it gave us and then we'll actually, as we roll out that team, we'll continue to collect data to see if that continues to be the priority times to implement that team in the community. And so then we also looked at key measure 2 and developed some goals there. One thing I like in this table is that we also put in cost projections, and we don't need to get real exact and specific, but and so they were just listed as low, medium, or high. And a lot of times, you just have funding to go after the low cost projection projects. But that gets you started, that gets partners working together and can develop momentum to work on some of the projects that may be more costly. So there's some real value in doing this. And then the next slide, I know Audra is going to talk about the self-assessment. I'll say on that is that'll help you actually develop some of this for yourself by utilizing this Stepping Up Initiative self-assessment. It's a really easy tool to use that as a Stepping Up coordinator. I went through the self-assessment by myself, filled it out, and then at my meeting with our work group, we all then went over it together, and I asked them to correct everything that I got wrong or left out. And then we turned that in. So I'll turn it back over to Audra.
Yes, thank you, Mike. Next slide, please.
It doesn't want to advance for me. Hold on, guys. There we go. How's that?
Oh, too far.
Did I go too far?
Yeah.
See here.
That's the correct slide, isn't it?
I rearranged and put the handbook one first.
Oh, okay.
That?
There we go. All right. So the handbook book provides coordinators with a summary of each of those 6 key questions that county leaders need to ask. And it's one of Stepping Up's really foundational tools that provides a blueprint for counties to assess their existing efforts, and also progress tracking as these measures progress in their counties. This tool also provides facilitation tips and exercises that coordinators and Stepping Up councils can work through to really help drive their planning councils. And counties who are currently working on revamping their Stepping Up councils, have mentioned that the work has kind of fizzled out, whether that was strictly due to COVID or just kind of that unclear direction of work. They've utilized this handbook as a self-assessment tool to really assist in providing a clear starting point and direction when they're looking at revamping their Stepping Up councils. And I'm going to provide you the link to that coordinator handbook, but I will also provide the link in a follow-up email post-webinar. Next slide, please, Risa. So as Mike was mentioning, the self-assessment tool is exactly, as he mentioned, it's a really helpful tool for coordinators to utilize. You can answer the questions as they are in real time at that point, but it's also important to note that you can go back later and redo things. Unfortunately, sometimes in communities, some programs or policies maybe not, they might fizzle out, or they might not be as strong as they want them. So people can go back and really redo those and redo that self-assessment to give you a good analysis of where you're at as you're working through the 6 questions and really trying to apply those 4 key measures to your initiatives. And I will also put another link in the chat here. Next slide, please, Risa. All right, so this is just a snapshot of the actual tool. And like I said, this is a living assessment. And so as Mike had mentioned, he filled it out, took it to his Stepping Up council, had them make edits, changes, and then go back and refill that out within the system to really help drive that Stepping Up work in your county. And then the last tool I really wanted to discuss today, next slide, please, Risa, is the Stepping Up Strategy Lab. And this is an inventory of policies, programs, and services that other sites are implementing, featuring more than 110 examples from counties and cities across the country. So you can go in and filter by which intervention you would like to search. And it also filters by intervention according to the 4 key measures. So if you go in and search for co-responder, that has a really good impact on key measure 1. You can also go in and search for general categories like law enforcement or behavioral health or reentry, or whatever topic it is that you're wanting to go and find some more information on, or examples from how other counties and cities around the country have implemented different services and policies. Next slide, please. Okay, so just a quick announcement, and then I will pass it to Risa, and then we can open the floor for questions. Peer-to-peer connection hours are always the last Thursday of the month. And for those of you who haven't participated in one yet, this time, well, they are a loosely facilitated time to provide you an opportunity to connect with other counties across the state of Kansas. So it is Kansas specific. And it's just a way to develop collaboration and peer learning from one another. I feel like these have been really successful thus far, and counties have really utilized this time to discuss topics related to current projects or policy implementation, process improvement, and collecting data, a lot of questions about dashboards and different things like that. So I would really encourage you to join these reoccurring meetings, when they could benefit you to have that peer discussion and ask those questions that you might be tackling within your own Stepping Up Council, because that's exactly what those peer connection hours are for. So next slide, please, Risa.
Okay, everyone, I'm going to take this one just because I've been really on the ground working on the Taking the Call conference. It is scheduled for October 20th and 21st virtual. As you can see, it's kind of a midday start till 5:30 to accommodate all the time zones. It's free. You just need to go on and register. And there's a link, and I know Audra will send that out later as well. It's, just I hope you've already registered. We had a provision where you could register as a team, but that is now closed. But certainly as individuals, you can register and certainly coordinate together anyway. And we're pulling together a separate workbook for Taking the Call, and we will be releasing that to all registrants, not just those who are on the team time part of the conference. I just wanted just a couple of seconds around, this one, the Bureau of Justice Assistance and the Department of Justice came to the Justice Center and asked us to work with them on pulling this conference together, just because so many communities across the country are working right now in alternative responses to crisis calls, and particularly the non-law enforcement response and how that fits into a more comprehensive, robust crisis response system that is, across the country, I said, being discussed in many, many jurisdictions. So a lot of emphasis will be on the, what these programs are looking like and how they've taken hold and so forth, but it's also going to be very much focused on system-wide planning for crisis response. So I will just give you a little tease with some very high-level government officials who will be speaking, and certainly hope that you all can clear your schedules and attend. Thanks, Audra.
Yeah, absolutely. Okay. I was asked quickly to put in the link for the strategy lab. So let me pull that up and I will add that in to the chat. And again, I will post these or add these into the follow-up email from this webinar. So we have plenty of time for questions. I think Mike and I really sped through our slides here. So if anybody has any questions, feel free to unmute yourself, raise your hand, whichever you prefer, and we can get those answered for you, hopefully.
Hello, everyone.
Hi, Brenda.
I am jumping way ahead here, but something popped in my head, Mike, when you were presenting some of your information and from prior discussions that we have had. Has there been any work done across the states for those that are trying to do the work in a metro area where there's such connections of different states and boundaries and counties? Such as where we're located, we get a lot of Missouri that comes over across state lines. And, now, Mike, now that you're with Johnson County, you're going to get Wyandotte County and Missouri. My curiosity is, when you're providing your data information, sticking strictly to the county matters, has there been any discussion of metro connections for information?
Brenda, this is Mike. I'm also going to invite Risa to chime in on this, because when we were working on these sequential intercept model or mapping for Johnson County, that was a big part of our discussion. And I know that we involved Mark, the Mid-America Regional Council, in some of those conversations. Right now in Johnson County, about 50% of the jail population is Johnson County residents. So that's exactly what you're talking about, Brenda, where we're working to try and connect with people with resources who don't live in this community and necessarily part of some of our planning teams. So being here 2 days, I'm not real familiar with lately what is being done to make some of those connections. And so I'm going to let Risa try to answer some of that, but I also know Chris Schneewise from Johnson County is on here too, and he may be able to answer that too.
I'll just jump in real quickly. I do remember, also the requirement that a person must be served by their home county's mental health center, and just trying to do the best you can at jail discharge for those who have screened or been assessed as seriously mentally ill, to try to do what you can to ensure that connection to care, particularly when you need to connect again, like to another county in Kansas for the mental health center piece. I remember those discussions. We'll let Mike get a little more time under his belt, but I will tell you right now, I am advising on a JMHCP grant that is being administered by MARC, the Mid-America Regional Center there in Kansas City, to grow co-responders in Lee Summit. Oh goodness, I'm not going to remember, 3 cities on the Missouri side. That so I mean, I think there would be a lot of opportunity for discussion there that maybe can get regenerated if it's maybe kind of gone away or what have you. I don't know if that's helpful, Brenda, but it's obviously a lot of opportunity there. I know.
Yeah, we have had metro-wide CIT meetings. And again, I'm jumping way ahead because we are starting at the very beginning here, but I'm the one that keeps track of everybody that comes in the jail every day. So I've already done this morning, and our trends are changing of what's coming in. We just had our CIT training here in our county last week. But what happens lots of times is, I don't know if anyone's heard of Truman Medical Center in Kansas City, Missouri. We end up stopping in our tracks because we get individuals coming across state lines and they live in Missouri and they can be treated by Truman, but they can't be treated over across state lines. And so in keeping the data, I don't know where to keep it, if that makes sense, because the individual doesn't reside in our county. And as you said, Mike, a lot of your 50% are coming into your jail that are non-Johnson County residents. I don't know if that's a separate data to keep, or we just lump it into one, because what I foresee happening and what I see as the result of the data is we don't have as many showing success rates because we don't know what to do with them.
Mm-hmm.
Brenda,
so that's where I was just curious how you handle that.
On the guidance for set, measure, achieve, there is a little footnote, and I wrote that footnote about, if you can, if your IT system has the capacity to pull out. I mean, I totally, was on board with that. You can't, this is the people that you can have some sort of responsibility for, and who you would remove from your data when you do your data cleaning. So non-residents, interstate compact, I mean, just federal holds, those kinds of different, generally there's ways of coding that in jail management systems as a way to maybe pull that out. And not that you might not, want to track your overall, like, recidivism rates for, who's booked in multiple times and that kind of thing. But, as far as, maybe starting to really show where you've made impact with the population that you have some, responsibility for. I mean, like they're going to come to your home, mental health center, they're going to be on probation supervision in your jurisdiction or whatever. I mean, that you can try to clean your data and have that as a separate pool of people. And I can't remember word for word how we put that down there in the footnote, but we did pull that out, those kinds of criteria.
I'll jump in here real quick. Excuse me, real quick. Chris Schneewise with Johnson County Corrections. We have expanded MyRC across the metro. So My Resource Connection, we are doing that for the city of Kansas City, Missouri. We are in the infant stages with unified government. And I know the medical director over with the city of Kansas City, Missouri has been very instrumental on trying to get data, not just from the EMS system, but also from Truman Medical, to be able to link that up. Now, the doorways are not open at this present time for us to share data across state lines or county lines, but the data does all reside in one repository. The repository that feeds MyRC, all the data from Douglas County, Johnson County, City of Kansas City, Missouri, Wyandotte County, all those, it's all in one location to where when the time is right, maybe with Mr. Brower's help, now that he's, you know, the new criminal justice coordinator, we can have some of those discussions of how do we open those doors? Where is it appropriate to open those doors? So that way people do know when they're interacting, because like, you know, somebody that is currently working with Johnson County Mental Health coming into Johnson County Jail, we'll know if they've been at RSI because MyRC, that data is all there together. We can notify people, again, where it's legally appropriate to do so. I think that's a really good opportunity where the data can be housed in one location. We have to be able to link to it.
Yeah, I think that would be good. That's one piece that when I report to our elected officials here and our commissioners, that I don't know quite how to explain when I'm speaking to them and saying, okay, you got 38% over here that they are in our county, but they're not in our county. And so as far as data wise, I was just curious if there's ever been any state or if you've already encountered that, because I think it would be good, as you stated, and it sounds like you've already got that started, where we all can put our heads together of what we're doing for that. So I appreciate your input. Thank you.
Yeah, because we've been part of, we've had some conversations specifically on the City of Kansas City, Missouri side about frequent or high utilizers and being able to use the data that's coming into MyRC. And it's getting that link, you know, again, if we could link to Truman to be able to get some of those admission and discharge data. I know Mike, and he can probably speak much more eloquently about Douglas County, but Douglas County had Lawrence Memorial Hospital feeding admission and discharge data into MyRC. So, I mean, they had some opportunities that we don't even experience in Johnson County, but I think the opportunities are there. We just got to talk to the right people and get the data connection set up.
Great, thank you.
Right, thank you, Brenda. Great discussion. Thank you, Chris and Mike, also for your input. Any other questions from anybody else in the group before we? And Raisa, you might just go ahead and advance the next slide. Okay. I'm not hearing any other questions or seeing any other hands raised. So here is my contact information if anybody doesn't have it. I can give everybody a little bit of time back in their afternoon. I'm sure it'll be welcomed. Thank you so much for joining us today, and I really hope that you have learned more about the process analysis, prioritizing policies and tools that are offered by Stepping Up. Please feel free to reach out if you have any questions or want any follow-up on anything shared here today. And thank you all really for the work that you do, and absolutely to KDADS for your partnership and support of this TA Center. I hope you all have a great rest of your week, and our peer-to-peer connection hour is coming up very soon, so I hope to see most of you there, and we can further discussion that we were just having, Brenda, or any other questions that might come up before then. All right, thank you all so much.
Thank you.